You know that familiar lub-dub sound of a heartbeat? Well, it turns out there's a whole hidden language in there. Clicks, whooshes, and swishes that can tell us so much. Today, we're going to decode one of the most common and, let's be honest, misunderstood of these sounds, the heart murmur. We're going to figure out what it is, what it isn't, and how doctors can listen in to understand the story your heart is trying to tell. Okay, let's just get right to the big question on everyone's mind. The second you hear the words heart murmur, your brain can immediately jump to the worst case scenario. So, is it dangerous? Well, the answer is it's complicated. And that's actually good news. It means that a lot of the time, a heart murmur is completely harmless. And by the end of this, you'll understand exactly how doctors tell the difference.
So what is a heart murmur, really? At its core, it's just an extra sound. Think of it like a skilled mechanic listening to a car engine. That little whoosh or swish is the sound of blood flow that's a bit turbulent or speedy. It's not a diagnosis itself. It's more like a clue that tells the doctor, hey, you might want to listen a little more closely here.
To solve this little medical mystery, doctors always start by ruling out the most common and harmless causes. We can think of these as the innocent suspects, cases where that unusual sound has absolutely nothing to do with a broken or damaged heart. And this is really the key difference right here. Murmurs basically fall into two big categories. On one side, you have organic murmurs, where a valve is actually damaged. But on the other side, you have what are called functional murmurs. In these cases, the heart's structure is perfectly normal. The sound is just a byproduct of how the blood is flowing through a healthy heart. So, what causes these totally harmless murmurs? All kinds of normal stuff, actually. It could be blood flowing a bit faster because you're exercising, or maybe a condition like anemia that makes your blood a little less thick. They're actually super common in teenagers whose hearts are growing really fast. The big takeaway here is that these are often just temporary situations, not a sign of a permanent problem with the heart itself. All right, now here's where it gets really interesting. A little plot twist in our investigation. Sometimes that strange sound a doctor hears with a stethoscope isn't actually coming from the heart at all. It's coming from the neighborhood, the other organs and tissues right next door. These are the imposters. A doctor might hear a little scratching sound from the sac the heart sits in, or even some friction from the lungs rubbing up against it. So you see, the very first job for our heart detective is to figure out, is this noise coming from inside the house, or are the neighbors just being a little loud? So once the doctor has confirmed that the sound is coming from inside the heart, that's when the real investigation begins. Now they have to analyze every single detail of that sound to figure out precisely where it's coming from and what it means. This quote right here explains the fundamental principle of the whole thing. It basically means the sound of the murmur literally follows the path of the blood. So if blood is being squeezed through a tight opening or leaking backward through a valve, that whoosh sound travels right along with it. This gives doctors a kind of sonic map to follow that leads them right to the source of the issue. And this is basically the detective's checklist. First, they find the exact spot where the sound is loudest. Then they define its character. Is it a soft, blowing sound, or is it harsh and rough? They trace where the sound radiates to. And this next one is crucial. They note its timing. Does it happen during the heart's big squeeze, which is called systole, or during the relaxation and refill phase, known as diastole? Even listening for how the sound changes when you breathe or move gives them vital clues. Every answer is another piece of the puzzle. And here is just a perfect example of this detective work in action. When you take a deep breath in, it actually increases the amount of blood flowing to the right side of your heart. So if a murmur gets louder when you inhale, that points the doctor toward a valve on the right side. And if it gets clearer when you breathe out, they start looking at the left side. It's just incredibly clever. So after gathering all of these clues, the location, the character, the timing, how it changes, the doctor can finally put it all together and reach a verdict. This whole process lets them figure out not just if there's a problem, but precisely what that problem is, and even if there are multiple things happening at once. This is how those patterns start to tell a really detailed story. For instance, if a doctor hears two different murmurs, one during the heart's squeeze and another during its rest, but they're both coming from the same valve, that points to something called a combined defect. But if they hear one type of murmur over here and another type over there, they know they're probably dealing with at least two separate issues on different valves. The specific combination of sounds reveals the whole picture. So what is a combined defect? You can think of it as a double whammy for a single heart valve. It means the valve is both too tight and narrow, making it hard for blood to get through, and it's also leaky, letting blood flow backward when it's not supposed to. By carefully analyzing the murmur, a doctor can diagnose this incredibly specific, complex situation just by listening.
So look, if there's just one thing you take away from all of this, let it be this right here. A heart murmur is not the end of the story. It's the very beginning. It's not the diagnosis, it's the clue that kicks off a detailed investigation. It's really just the heart's way of saying, hey, you might want to listen a little closer. When you get right down to it, the language of the heart is complex, sure, but it's not something we should be afraid of. It's just something to be understood. Those little clicks, whooshes, and swishes are just data points, telling the incredible ongoing story of your health.